Good morning. I'll call to order the Board of Health for the town of Shrewsbury meeting on May 21st. It's 8 a.m. I'd like to invite our town manager, Mr. Kevin Mizikar, to address the board. Morning, Mr. Mizikar.
Good evening, board members. I think this is the first time I've been before you, so it's a pleasure to be here, and thank you for all your work, and I admire the work that you do and appreciate the challenging situations that you're always in and always do a great job, so thank you. Thank you for your service to the town. I'm here today to talk about next steps for the operational side of our public health. The board, of course, serves, as you know, as the policy and advisory entity. And on the operational side, we've had the distinct pleasure over the last more than a decade now to have a great regional partnership led by the city of Worcester. By way of short background, Shrewsbury and Worcester first partnered together just as two entities and then expanded into a larger regional alliance that was the first nationally accredited multi-jurisdictional entity in the Commonwealth. So a lot of great success and a lot of change has happened really over the last 10 or 15 years. And with foundational public health coming about in the Commonwealth and in the state looking at how it's going to fund and support entities, there's become an opportunity to kind of reassess how we provide regional public health services, and the state has recognized that in some instances, large cities, really three of them, Springfield, Worcester, and Boston, are quite different than the surrounding suburbs and have different challenges, and they're kind of incentivizing those larger cities through the public health excellence grants to be able to go on their own and receive, similar financial support that they do through a regional entity. So in conversations with the city over the past few months, we found an opportunity. Basically, the city will be, a single entity when it comes to public health services. And then the three towns are going to stay formed together and cross-jurisdictional sharing and really continue the regional aspect. I'm really excited about this. I think there's a lot more commonalities between the towns than there was between the cities and the individual towns. And Shrewsbury is going to step up and be the lead entity for that regional alliance. So we're actually going to receive significant financial support from the Commonwealth, from the Office of Local Regional Public Health, and subject matter expertise that will support us in getting the new region set up. And I'll briefly talk about what we have been doing in partnership with the Office of Local Regional Public Health over the last really probably 5 or 6 weeks. Myself and the Assistant Town Manager for Human Capital have been developing job descriptions and sending those to the state for review. We're preparing a new intermunicipal agreement that will be required. One of the main distinctions with the new regional approach that's being managed through the state's kind of catching up with Shrewsbury and the regional alliance and the city from where we were over a decade ago. But they're requiring so when we were partnered with the city and the other towns were partnered with the city, it was kind of just a bilateral relationship. So the city had an intermunicipal agreement with each municipality on their own. What the new Public Health Excellence Grant requires that everyone joins together in multilateral agreements. So there's going to be one intermunicipal agreement that every municipality will sign, and not just every select board, but every board of health. So we'll be back before you and each and every other board of health to review the terms and conditions to make sure what's in your policy vision can be carried out through the operational framework and agreement among the cities and towns. And so as we look forward, we're looking to make this transition effective July 1. And we are, once we get those job descriptions approved and confirmed by the state, we'll be moving on to posting those positions and then partnering with West Boylston and Grafton to do interviews, engage with their boards of health. The financial arrangement with the state for the three towns is substantial. We'll receive $461,000 for public health work for fiscal year 26 alone, and then the same amount for fiscal year 27. So I'm excited to really kind of turn the page, and my initial vision that I want to share with you and then work with you on would be to really to do this as one would expect us to do it in 2025. Get a baseline of public health conditions in all the communities, and then build programs that we can measure and track over time to show our progress and make changes as we see fit. And I think it's kind of just, you don't get to start over many times in life, in our line of work. So I think this will be a unique approach. So what we're doing is getting everything set up operationally for July 1. What we will need to engage with you all with is, in the near term, hopefully getting everyone together, as many board members together from all three towns in a single meeting, and having this conversation with everyone there, letting them know what we plan to do and how we plan to support them. As we get staff in place, having the leadership of every town involved in that, making those decisions, and then keeping each and every Board of Health informed and involved. And the framework will be rather similar, but the lead entity will shift from the city of Worcester to the town of Shrewsbury, but very similar functions. We'll be well resourced financially. It will be a challenge over the next 2 years to get a sustainable financial model in place to make sure that once we lose that money from the state, that in FY28 and beyond, we can continue to do the things that we all want to do for public health. So that's what that's the direction that we've been headed in a nutshell. It's like I said, it just it's a new opportunity for us to pursue, and I'm looking forward to that. So I will keep you informed and look for your advice throughout the course of this, and I'm happy to answer any questions you may have, or talk about any aspect of it in detail.
Thank you so much for being here. I know you've had long evenings with other meetings, so appreciate your being here this early, and we're excited to partner with you. So we remain obviously to be valuable team members. Turn to our other board members to ask if they have questions for Mr. Mizikar.
No, just to agree that excited for this new opportunity, and really looking forward to supporting the vision and sustainability for this as well too.
Awesome, thank you.
Yeah, I have no questions. Thank you.
Awesome, sure. Of course.
Thank you so much for being here this
My
early.
pleasure.
Yeah. Thank
Hope
you.
you guys have a great rest of your meeting, and we'll stay in touch through Carrie with no doubt.
Absolutely.
So thank you.
Yeah.
Thank you.
Thank you, Kevin.
Have a great day. Minutes of the April 30th Board of Health meeting were distributed electronically. If there are no amendments, I'll entertain a motion to accept them as written.
Motion.
Thank you. Second, Ms. Walker.
Second the motion. Aye.
Thank you. Ms. Rosacci.
Aye.
Ms. Walker.
Aye.
Abraham votes aye. The minutes are unanimously approved. I would like to congratulate Ms. Walker on a new addition to the family, and applaud her for being here so early, back from a difficult but joyful time. So
Yes.
congratulations.
Thank you.
To the newest addition to our town family.
Yes. Thank you.
Great. Now turn over to Ms. Houghton for our communicable disease update.
Good morning to the chair, to the board. I'm Amelia Houghton. I'll give you the nursing report for communicable diseases. This is for the month of April. So I did send in a written nursing report that listed influenza, COVID, and measles cases for March and April. The numbers for April and March were reversed. It's actually influenza cases. In March, there were 18, and in April, in March, there were 48, and in April, there were 18. So I will reverse that and resend that to Carrie to update the meeting minutes. And also for novel coronavirus or COVID, that one is correct. March we did have 8 cases, and in April, we had 1 less, 7. And of course, again, these are just reportable cases, not what is actually out there, because not everyone who tests reports their results to the state. And along those lines, so far, no measles cases in this region. So just a few updates on some activity in the area and nationally. So for flu and bird flu, currently the seasonal flu, seasonal influenza, the activity is low and it keeps declining, okay? Even though this is a very high severity season. And what's important is the last high severity season was back in 2017, 2018. So, I'm just going to move on to the H5. So there are no new influenza A, which is H5 cases, and that's the bird flu, what we call avian influenza. To date, no human-to-human transmission, okay, have been identified in the United States. Nationally, in terms of respiratory illnesses, it's been stable. It's been stable for the past few weeks and still below baseline. And all these reports are from Health and Human Services, from the CDC, and they all report that region-specific numbers are below baseline. So we're doing a lot better with respiratory illnesses right now. In terms of flu, even though you could still get the flu vaccine, the season is ending, but there are antiviral drugs. There are prescription antiviral drugs that can treat the flu illness. So those should be started as early as possible and are especially important for patients at higher risk for severe illness. The CDC provides updated integrated information about COVID, flu, and respiratory syncytial virus, which is RSV, on a weekly basis. And I've added a link here, which you'll have in the meeting minutes as well, where you can investigate some of this if you're so interested. And it's basically the cdc.gov respiratory viruses index. And that's a link that's been provided. And in terms of COVID, also the latest COVID data for the United States shows that the cases and the hospitalizations still remaining low. And another link for that, for more detailed and up-to-date information, you can check the CDC COVID data tracker or the USA Facts COVID-19 dashboard, and there's a link here for that tracker. Just a few words about measles, because it's still prevalent. The cases in the US have surpassed over 1,000, and that's confirmed cases, still across 31 states. And this is as of May 15, so this is pretty current. Texas still remains the epicenter, followed by, next in line would be the next 3, New Mexico, Kansas, and Oklahoma. And to this date, still 3 deaths have been reported, 2 children in Texas and 1 adult in New Mexico. So from the CDC, they warn that 93% of cases are linked to outbreaks, primarily in communities with low vaccination rates. Health officials stress the importance of the MMR vaccination, as 96% of infected individuals were either unvaccinated or had unknown vaccination status. So there is also a real-time update tracker from the CDC. I've added the link here. And that's just the cdc.gov Measles Data Research Index. The link will be provided to you. Just a little bit more on measles because this is so important. Measles is not a seasonal virus. However, measles is often spread over times of high travel, like spring break, or in situations where unvaccinated persons are in close quarters, like coming up summer camp. The measles virus, what's important to know is one person can infect 12 to 18 people, and the virus lingers in the air up to 2 hours after the person has left the room. So, contrasted with the flu virus, one person can infect up to 3 people, so the measles virus can infect up to 4 times more people than the flu virus. That's why it is so important. Some precautions for the measles virus include vaccination, ensure you and your family are up to date with the MMR, vaccine, it's the most effective way to prevent measles. Hygiene, of course, regularly wash your hands with soap and water, especially before eating or touching your face. Avoid crowded places. If there's an outbreak, avoid areas with large gatherings or where cases have been reported. Isolate if sick. If you or someone in your household shows symptoms of measles, fever, rash, cough, for example, seek medical attention. Stay isolated to prevent spreading it. The CDC is currently creating models to show how measles outbreaks could occur and spread in the United States. These models can be used to help health departments better identify communities at high risk and manage healthcare resources, especially in schools. Models are very useful. So obviously there are other global outbreaks, not just measles, and there are travel notices that are important if you travel that you should do some research on. So I've included the disease outbreak news link and the travel notices / travelers health from the CDC link as well. And you can obtain a lot of information on travel vaccines and where the outbreaks are. So that's the end of this current report for April, unless anybody has any questions.
No questions for me.
No questions
Thank you.
Great. Thank you. And now to the Regional Public Health Alliance update from Mr. Pansky.
Good morning. Since April 30th, we've conducted a total of 52 environmental health inspections. Majority focus has been on our semi-public pools. Most are very eager to get inspected and open by Memorial Day coming up. So after the inspections that'll be conducted today, my hope is that we'll be just about halfway done, a little bit more. And we did receive one emergency complaint. A car had ended up in Brody's Diner. There was minimal damage to any food preparation area, and the food was not directly impacted. So once they were able to fix the structural aspect of things and get it cleaned and sanitized, they were okay to reopen. And then we did receive one foodborne illness complaint from the Ground Round, which, being a new establishment, prompted a full routine inspection as well. So I did go over sort of their training with new staff and how they're operating, being so freshly open, and we did discuss their cooling and reheating procedures for some of the food and sanitizer, to make sure that they're eliminating those risks of any foodborne illnesses. So they are still working out some kinks, but overall it was pretty good, and there was no additional reinspection needed. And then just staying in line as best as possible with all of the routine food inspections for our establishments in town.
Questions for Mr. Pansky?
No questions.
Thank you.
Great, thank you. All right, we're on to our next meeting, which I believe is June 4th at 8 a.m. That meeting will also include a public hearing where members of the town can take 3 minutes each. We'll take up to 5 people who can share any concerns about any health issues or anything that is relevant to our Board of Health. And that'll be about once a quarter, so our first one starts next month, so we just want to plan time accordingly. Great. If there are no other issues, we'll take a motion to adjourn.
Motion?
Thank you. Second?
Second motion?
All right, Ms. Rosachi?
Aye.
Ms. Walker?
Aye.
Abraham votes aye. The meeting is adjourned. Thank you very much.
Thank you.
Thank you all.